Hi everyone, welcome back. Today we're joined by Mikelle Moore, Senior Vice President and Chief Community Health Officer here at Intermountain Healthcare to talk about how we're serving the vulnerable populations, not only during COVID-19, but all of the time, and what Intermountain is doing to help those people out. Mikelle, thank you so much for joining us. We really appreciate it.
Thank you, Amanda. Happy to be here.
It's nice to see you again and have you back as well. So I know that we are always doing things in our community to help serve that vulnerable population, especially during COVID-19, but also a little bit more broadly. What are some things that we're doing to help support that population, and what are some of the challenges that this population is also facing?
Well, Amanda, I think it's maybe helpful to start with, when you think about our mission of helping people live the healthiest lives possible, we've always known that that's not something we can just say or, expect that people will access our hospitals and clinics when they need them, and that that's the only thing we can be doing and achieve that mission. We've known we have to understand what are the needs of our community, particularly the most vulnerable. And typically, the most vulnerable people in our community are low income, lower education, elderly, children, particularly children experiencing poverty, people with mental illness or disabilities. There's lots of people that we think of as vulnerable. And understanding the health needs of those vulnerable populations is part of our work as an organization to ensure that we're doing everything we can to meet that mission. So that's long meant making sure that we have connections to those communities, that we're providing services that reach out rather than just hang up a shingle, so to speak, and expect that people come to us. And COVID has provided us some opportunities to be very specific in saying, what are people's needs right now? And, we conduct a community health needs assessment every 3 years that's very diligent and thorough and looks at a lot of data. But we've been able to look at data related to the COVID response that we've had as a state and as a system. And we've also been able to reach out to hundreds of partners across our service area to say, okay, think about all these vulnerable populations, people of color, elderly, people that are in group homes for disability or mental illness. What are your needs? What are the needs of the people that you're serving, and how can we respond to those? So it's been really nice to have something concrete to focus on as a reason for outreach and thinking about ways that we can serve. And I'm really grateful. It fits with our mission. COVID is going to help inform the ways we can better serve vulnerable populations always, but it's giving us some really specific things we can do right now.
I know last time, too, we talked about how you're working with the homeless shelters for test results for COVID and making sure that there was some sort of connection between when they came in to get tested and actually getting those test results back out to them. So it's great to hear that we're still doing all of these things and we're still focused on those populations. It didn't just go away because it slowed down a little bit. And outside of COVID, too, how are these vulnerable populations, how are we making sure that they actually have access to healthcare and that it's safe for them to go get healthcare, whether it's a just annual checkup or if they actually hurt themselves and need emergent care?
So I think there's two things in what you're asking. You're right. We were able to respond very quickly as COVID emerged to ensure that our homeless population had access to testing. We took testing to the homeless resource centers and ensured people had access. Maybe what we couldn't see right off and that we've responded to more over time is how do we reach populations or people in our community that are vulnerable for other reasons than being homeless. We've learned that people who are living with multiple generations are at greater risk of getting COVID. We've learned that people that are working in essential work situations where they can't social distance the way you and I are right now in their work, or maybe feel pressure, whether it's expected or implied pressure to go to work, even if they're sick or symptomatic. That's created a lot of risk for COVID and a lot of disparities. So it's not just about ensuring people have access to testing. It's also thinking about what are the policies, the underlying infrastructure that exists in our community that creates that pressure or that exposure to work in unsafe conditions, or just presents greater risk of getting sick, whether it's sick with COVID or sick with the flu during flu season, or maybe just greater stress overall in life. And so this is giving us the opportunity to think about outreach. Certainly, we've been going to test in communities that are experiencing COVID at greater rates, but also beginning to work with employers on how do we change policies? How do we create back to work policies that protect people regardless of their need to be at work? And that's really been helpful. The other thing that we've been noticing is they're fearful of getting tested sometimes. Particularly people who have mixed immigration status are concerned about coming to a test site for fear that they could then prompt an immigration investigation. There's even been misunderstandings that they would be required to show identification at a test site. That's not true. They've been worried about paying for testing, or even thinking about, what if I am positive? How am I going to get the treatment that I need if I don't have insurance or don't have access to care or the means to pay for care? So we've been doing a lot to dispel misunderstandings about testing, making sure people know it's free, that we don't require identification, and really trying to, we may not be the most trusted source for this or have connection to those communities. So we've been doing a lot of outreach with community partners to create word of mouth and trusted community members saying that getting testing is safe, it's not going to threaten immigration status, and that there are resources for getting care. Intermountain will provide those resources for care if you're tested positive and need hospital treatment. So it's a lot of relationship building, using ambassadors who are trusted in the community that we're trying to reach to ensure that people understand how they can access COVID care, but also making that link to this isn't just about getting care for COVID. You can still use the emergency department if you have symptoms for any condition that requires emergency care. Our hospitals are still safe for delivering babies, getting surgery that you need, and continuing to get your well care attended to is really important. Colonoscopies are down significantly since all of this started. Primary care visits are down considerably, and part of that was intentional, right? We intentionally directed people to delay certain types of care. We're now safe and able to provide most of that care, and we're really encouraging people to get back to those routine things of caring for themselves, because it's really going to be important. We need to care for our health in preventing COVID, but also preventing diabetes and mental illness and substance use and all of these other things that we know are significant health issues in our community.
Yeah, I think it's really important for people to go seek the care they need right now, because if you don't, you could actually prevent or increase your chances of more health risks later on, especially if you're a part of that vulnerable population who thinks that they can't go get care or it's not safe to go get care. I think that it's really important for that population to understand that we're still here. And I know one thing Intermountain has done too is we started a Spanish Facebook page. We've been translating a lot of our materials into Spanish and getting that out into the Hispanic community in Utah, so that way we can reach them a little bit better, because we learned that they weren't getting access to all the materials we were putting out, which I think is something we've learned over COVID, and it kind of pushed us to do that. But it's been really interesting to see that happen. And we talk about vulnerable populations, but there's also high-risk populations, and those...
Well, if I can just comment on what you just said, because I think it's so important. I don't want to gloss over it, that we say, and there was a great article in the Tribune over the weekend about how we were slow as a community, not just here in Utah, but nationally, to respond to getting the message out in culturally competent ways, whether that's language or reaching people of color. These are typical vulnerable populations for lots of diseases because of the economic and societal, political, policy-driven underpinnings in our country. And I am so glad that we had this experience to figure out we're not responding adequately. You're not getting our message out in Spanish as we need to, and we can correct that. We're getting great kind of near real-time feedback that we can correct, and it's going to teach us so many things about how to do better communication for lots of different things that we need to be communicating with vulnerable populations, really, as it relates to healthcare.
Yeah,
right?
and the employee health hotline that we have too, I know that that's available in a couple of other languages too, which is great because it's not just people who speak English who are affected by everything going on in the world. So I think it's really great to see everything that we're doing, and it's interesting that it's taken this pandemic to kind of push some of those things forward, but sometimes that's what you need. You need this catastrophic event to happen for people to say, okay, maybe we need to do other things to reach everyone that we need to reach.
Absolutely. And I think that the racism and anti-racism movement that George Floyd's death prompted, a resurgence of that conversation is going to be really important to driving that point forward as well. That, we need to be more disciplined in ensuring that we're communicating with all people and that we are acknowledging that I'm a white woman. I can't necessarily understand what it's like to sit in someone else's shoes in a person of color or a Spanish-speaking individual or a refugee. And we really need to ensure that we are bringing different voices of color and perspective to influence the way that we deliver care, the way we communicate about what care is available. So many things we have the opportunity to improve, and that will help us address the health disparities we see in COVID, but also the health disparities we see in lots of other diseases that affect our health and well-being.
Yes, I think people need to understand too that what happened with George Floyd is not a political issue either. It's a human rights issue, and it's about people. It's not about politics.
Right.
And healthcare is something that everyone should be able to access, regardless of what you look like, where you're from, what language you speak. So I think it's great to be a part of an organization that's really trying to learn and listen from the community about what's going on with that.
Completely agree.
Yes. So with the vulnerable populations, we were also talking about the fact that there's also high-risk populations and what the two differences between those are, specifically for COVID, and how there's certain high-risk populations that can be affected a little bit more by COVID. Can you talk a little bit about who those people are and what we're doing to help that population out?
Yeah, and I think it's important. There's a distinction of high risk that's been defined by the state so that we can give additional resources to high-risk individuals to help them with potential needs. And I'm just going to reference that because I think it's important. For any individual, we know a lot of people are facing hardships in terms of knowing how to access food, maybe being able to find a place to stay where they can safely recover from COVID or separate themselves from someone who is recovering from COVID. And the state, in recognizing that, said, for certain high-risk individuals, we want to make some services available. And so for people who are high risk, meaning anyone age 65 or older, who has underlying medical conditions involving hearts and lungs, severe obesity, or an compromised immune system, falls into a high-risk category. For those individuals who are at specific high risk, or for those who care for someone who meets that criteria, they can call a 1-800 number and get help with grocery shopping, getting access to meals, medication delivery, or guidance on how to get other assistance. And I think that's a really nice resource that I want to make sure people are aware of. And that phone number is 1-877-424-4640. We also know that people during COVID are at higher risk for stress, and we are now doing stress screenings in our hospitals to ensure that that we're aware of that, and we're doing temperature checks and screenings and those kinds of things to ensure we're catching people at risk. But when we look at who's at risk for COVID, when you look at what who's getting COVID at greater rates than others, we see that people who are living in skilled nursing facilities and in other group living situations like mental health or substance use treatment facilities or group homes for people with disabilities. Other congregate living situations are at much higher risk for COVID. And that can include families that are living in multiple generations where there are older, some high-risk individuals that we just talked about getting those special services from the state, but then also have people who are going into workplace settings and potentially bringing that risk home are at greater risk. And we know that in our community, Hispanic, Latinx community members are experiencing COVID at a higher rate, not because of their race or because of their ethnicity or their genetic makeup, but probably because of the underlying environmental conditions in which they live or work in a higher predomination. So we really need to understand those policy issues that I spoke to at the beginning about how we create safe workplaces, safe work environments, and screen for those risks, because those are the same underlying issues that can contribute to other health factors as well.
So if someone does find themselves in need of some sort of care, we have launched telehealth. We've had it for a long time, but now it's become very important, especially during this pandemic. How are we using telehealth to reach those vulnerable populations in both an urban and rural setting? If someone lives 5 hours from their nearest hospital, how are we using telehealth to kind of reach out to those people to make sure they're still getting the care they need?
We are using telehealth in the coolest ways, in all kinds of ways to reach vulnerable populations. In fact, we recently passed our 1 millionth telehealth interaction as a company, which COVID certainly helped spur on. But there's a few ways we're working to reach vulnerable communities. One, when we have someone who's hospitalized with COVID and we need to ensure that they have access to the most recent evidence-based treatments that are available, we're using telehealth to connect our infectious disease physicians to an outlying hospital to talk with a patient and consent them for different treatments that are available. We are ensuring that we are able to do that in Spanish, that we're able to reach vulnerable communities, even vulnerable communities that are hospitalized in our setting. But we're also trying to ensure that people have access through the COVID hotline to any question they want to get answered about COVID, whether that means I want to understand how to keep my family safe, or actually go through the screening process. Do I need a test or connect to a physician or advanced practice provider to assess their symptoms and get care? We're providing all of those services in multiple languages, and that includes access to the Emotional Health Relief Line, which is available in all of the languages that we're able to access through our translation service. We really want these services available. Now, as I said in the beginning, just advertising these services and ensuring that they're available doesn't mean that they are truly accessible, that they feel safe to someone who's in need of services. So we're also a part of the Multicultural Advisory Committee at the state, where we are working with that commission to share these resources and say, please help us reach the communities you represent, and ensure that we're advertising these services in a culturally competent way, and that you as a trusted resource are actually telling your community about these resources. And honestly, I think that's probably more important than us advertising our phone number, putting these resources out there. If we can build trust within those leaders and ambassadors to our community, we can really ensure that we're listening to what will, if we're not offering something that makes sense, that feels safe and feels accessible, then we're going to hear back about it. And we're already hearing lots of feedback. For example, when we first did outreach into the Hispanic Latino community to do testing, we got feedback, please don't advertise it in the media, because that actually creates fear. And people don't want to go someplace where the media is also sitting there. They don't want to be interviewed. They don't want to be seen on camera. Let us do the outreach for you. And so with our next event, we did all grassroots outreach rather than announcing it in the media. So just learning by sharing our intent and our desire and the resources we have to help, and then listening to those who really know the community. We're doing a better job than we were 2 months ago in reaching the vulnerable communities we intend to serve, and we need to continue to listen in that way.
I think the trusted source is really important, because I can tell someone something, but I'm not a trusted source in the Hispanic community. I don't understand everything that they're going through. So I love the fact that we're using these trusted sources within different cultures to reach out to the people. I think that I am more likely to listen to someone I know versus an ad on Facebook, because it's a trusted source. So I think that's great to hear that we're doing that. The other thing I wanted to talk about, too, was the fact that it's also Pride Month. And we have a very large LGBTQ plus community here in Utah, and they require specialized health care. There is a lot of things that community goes through that someone might not be used to if they practice. How are we as a community or as a company making sure that they get the care that they need and that it's the correct care?
I so appreciate that question, and in particular, because it is Pride Month, it's a great opportunity for us to talk about this. This comes back to something we've already talked about, that we need to recognize and value the differences that are the beauty of our organization, but also the beauty of our community. And we are and need to continue to do more of ensuring that we have LGBTQ friendly providers, and that we're open about that. So we have a growing number of physicians and advanced practice providers who are saying, I am LGBTQ friendly, and I welcome you coming to my service. And we continue to want to support that. And I think it's so important. And, having people that you can identify with in receiving your care. It's just like trusting a friend when you're looking for advice on something. You trust a friend who says, this is someone I've gone to in my community for care. Let's ensure that you come to ours. That's a part of it. But we also need to ensure that our entire workforce, all of our caregivers, are aware that we provide care that's free of discrimination, bias, and that they join us in the commitment to that. And so that's something we've spent a lot of time educating and increasing awareness of. And we know that there are specific health disparities for people who are LGBTQ, just like there are disparities in different income levels or ethnicities. And we've tried to create awareness of getting access to care is a key function of preventing those disparities. So please don't put off care because you're uncomfortable or concerned. Please come to us for care. We really need to be a part of preventing disease and caring for people.
Yeah, and our Facebook Live last week, too, was with Dr. Matt Bryan, and he talked a little bit about that. And people asked the question of how they find out if their provider is LGBTQ friendly. And he suggested calling your insurance, and that they can help you find a provider, or, again, word of mouth, a trusted friend. Find someone in your community that already has a provider and see who they can recommend. So I think that's something great, and I know we're building out resources that'll hopefully be available in the future to make that a lot easier.
I hope we do. I hope we make it so that it's something you can access on your own. But Select Health Advocates is so great. If you say, I want an LGBTQ friendly provider, they have a listing. They also have a listing of, I want to go to a Black provider, or I want to go to a woman. They have access to. They'll even help you say, I prefer someone who has more of an East Coast background. I mean, whatever you're looking for, they have so much information and will help you guide. And I think it's just really important to ask for what you need.
Yes,
right?
I 100% agree.
Yeah.
Last question for you.
Okay.
What have you seen from this crisis that really gives you hope for the future, from not only our caregivers, but also from our community?
At the beginning of this crisis, I remember, how I felt personally during the first 2 weeks. I felt this sense of hope that, wow, our whole world is facing something together. And it's probably, other than something abstract like global warming, I'm not sure that we have all been in something together or felt that way. And I had this sense of hope in the beginning. I'll tell you, some of that sense of hope has gone away. It's diminished for me. And now I look at the information that we've been talking about here, the blatant recognition that we are experiencing COVID differently. There are disparities in the way we're experiencing COVID. Well, there's disparities in the way that people are experiencing life in our country. And I think that COVID has helped us have something concrete to talk about with regard to those disparities that should help us address the underlying issues that are contributing to the disparities we see in education, in wealth attainment, in health, all things that don't represent the America that I've wanted to live in or raise my kids in. And so I feel very hopeful as a company, as a community, and as a country, find healing, and I have a lot of hope in that.
That was very nice. You're going to make me cry. Mikelle, thank you so much for joining us. I really appreciate the time. And a couple of those phone numbers, just again for you guys. Our COVID-19 hotline is 844-442-5224. And our emotional health relief hotline is still available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks, everyone. We'll see you next time.